I'm Dr. Albert Malcolm. I'm a medical oncologist, and I've worked in Middletown for over 20 years. Lymphoma is a cancer of the cells of the lymph system. Lymph system is what we think of as the lymph nodes or the glands that swell up when we have infections. They protect us from infections getting into the bloodstream. There are different types of lymph cells. There's the B cells that make antibodies that help us with vaccines and to protect us from infections. Then there are the T cells that are part of the lymph system that help orchestrate and sometimes directly kill bacteria or tumor cells. Lymphoma generally presents as swollen lymph glands that are usually non-tender. They enlarge over time, sometimes rapidly if it's a higher grade lymphoma, very slowly if it can be a low grade lymphoma. A lot of times people have more a feeling of fatigue or tiredness, sometimes changes in sense of taste and appetite, and then weight loss can go along with it. They can get more frequent infections, but that's not usually a common presenting sign. It's overall just a change in how they feel. Fatigue is a very common symptom in people that develop lymphoma. Lymphomas are a complex grouping of diseases that span from T and B cell lymphomas, which are different from each other. Those would be non-Hodgkin's lymphomas, and then the classical Hodgkin's disease that we've all heard about over the years. The treatments are now based on what subtype of lymphoma it is and also the aggression of the lymphoma. Low-grade lymphomas tend to be treated with less aggressive treatment and are generally not curable, whereas the intermediate and higher grade lymphomas carry a chance of cure but also progress faster. Early detection of almost all diseases is advantageous to the individual. We would say that they would have less bulk of disease, therefore they would tolerate the treatments better. They usually are more fit. They have better energy, better protein status, better immune function when they're found earlier rather than late. It doesn't matter as much in low-grade lymphomas, but it absolutely is important in intermediate and high-grade. There are some conditions that are inherited that can increase the risk of lymphomas. Having certain autoimmune diseases and treatments for that can increase the risk of lymphomas. Also, people that are on immunosuppressive drugs, in other words, to control their immune system so that they don't reject organs or have autoimmune diseases such as lupus or psoriasis, can be predisposed to develop lymphomas. This has been known for a long period of time, and of course if you watch the TV commercials for many of the psoriasis drugs, they have in there a warning that they can predispose to lymphoma. If one has enlarged lymph nodes and they're tender, generally we would want to wait until we're sure that they aren't caused by an infection. That's a normal response in the body. However, if lymph nodes stay enlarged over a period of many weeks to months, they should be investigated for the possibility of lymphoma, although some can be lymph nodes that don't go back to normal after infections. But particularly if they're not tender and they've been there for quite a period of time, more than weeks, then they need to be evaluated for the possibility of developing one of these lymphomas. The cancer program at Atrium Medical Center has been approved by the American College of Surgeons with commendation. It takes a lot of work to achieve that and proof of ongoing improvement and quality care that's delivered in the institution. It's a part of reaffirming that we do what we need to give our community the highest level of care available. We work closely with Atrium Medical Center to help provide comprehensive cancer care for our patients. We have the availability of radiation therapy, robot-assisted surgery, and skilled professionals. Lymphoma has standard treatments available. However, when available, one should consider inclusion on a clinical trial because it gives the opportunity to have either newer treatments or standardization of treatment that's regulated very closely now.